too deep. Yeah, it felt too easy, huh?
Resistance. When you said where you are versus when I took it out and put it back in, I felt it.
Wow.
Yeah.
Unbelievable.
Oh my gosh,
Wow.
Nice. Yeah.
So you did both sides
Yeah.
back and forth?
Mm-hmm.
And the hands-on course was absolutely amazing. Dr. Tom pretty much changed my entire approach to how I would assess the facial aesthetics on a patient. The concept, his techniques, the Fern technique and the Palmer technique were both just mind-blowing.
I love dermal.
Oh, wow. You feel great.
It's definitely something that I feel like is going to change my entire game.
Revolutionary for a lot of us injectors. I think this is going to completely change the way I look at a patient.
Yeah, I agree too.
I mean, because think about it, how many times they come back, and again, I think, Leslie, we were talking about, they come back, they look good, but you're like, gosh, I think we need to put like 3 more syringes in you, because it's these tiny, tiny lines we're chasing, and it would just give them so
We're
much
trained
more.
to first look at cheeks,
The
temples,
volume,
and-
yes.
Yeah.
Yeah.
First.
And this is pretty atraumatic for,
Well, yeah, you're less vascular.
yeah, right.
Yeah,
And
and
the
so
risk
it's
of-
safer too,
Yeah, your risk of injury is
because
so-
you're not in a plane where you're really going to get into any of the important characters. Exactly.
She's happy about that.
Oh, it's all, yeah.
And sometimes
Safety
you don't
is
even need
important.
to treat the whole line because once you
Yes.
correct
Yeah.
it, which
I'm seeing.
Yeah.
We have just spent the day with Dr. Tom Van Eijk from the Netherlands learning his amazing techniques for supporting the skin and skin structures with the fern pattern, lip tinting, and the Palma technique for total facial rejuvenation of the skin. And it was the most amazing experience. Practice changing, amazing techniques in a great small group setting. Super lucky and very blessed.
15 years of injecting and absolutely revolutionized the way we will inject in our future practice. Can't believe this existed and we didn't know about it. Such an innovation for our patients going forward. Thank you, Dr. Van Eijk.
Super excited to implement this. Thank you again.
See? Oh, that looks good.
I can't believe it. Like, this side was a disaster. Wow.
I'm so happy for you.
I know. Thank you.
So today we had our training with Dr. Tom Van Eijk in Chicago. And I'm a nurse injector that lives in Chicago. And Dr. Cute.
I'm an oculoplastic surgeon from Central Illinois, and I do injectables in my practice as well as surgery.
And we've both been injecting for many years and have had multiple trainings in this country and have been overseas as well. And today was an eye-opener for sure.
At some courses, you learn a new injection technique. That's not the case with the Tom Van Eijk Academy. You're really learning a new paradigm, a way to think about fillers and have fillers in your armamentarium in a way that you haven't before.
oh yeah, oh my gosh.
You look awesome.
Oh, what a huge difference.
It's beautiful.
Oh my goodness. No, really.
Yeah.
I'm serious. Look at my eyes.
Beautiful.
Oh, and look at that so good.
Yes.
Yeah, I think that definitely when I go back to my office tomorrow, I'll be injecting differently, and I'll be looking at patients very differently. I'm really excited to start some of the treatments that I learned around the eyes today, in particularly, as well, of course, his fern technique in the folds as well.
There were a couple of techniques that we learned, but overall, the way of thinking about how I use filler is going to be different for me, And as I'm headed home, there are patients I haven't been treating because I didn't know exactly how to make them totally satisfied. And I feel I have that now.
Great.
I have a new tool. So
thank you,
we're
Doctor.
excited. Thank you very
Thank
much.
Oh my. Oh, I love it. Yeah, you can, yes, it's perfect, right? I was so nervous. Oh my gosh, yes, very nice.